Welcome to the Deep Dive. Today, we're really zeroing in on the assistant clinical manager role.
Mm.
We've got this interesting set of, common interview questions and the kinds of answers expected.
Right. It's like a backstage pass, isn't it? To
Oh,
see what organizations are really looking for.
exactly. So whether you're maybe thinking about this career or you work with an ACM or you're just, curious about healthcare leadership.
Yeah, this should give you a pretty clear picture of what the job entails. We're looking at the core functions, really.
Our mission then is simple. Give you a concise but thorough understanding of what an assistant critical manager does, what skills they need.
Now, we're pulling this straight from that interview process intel. Those questions, they tell you a lot.
Okay, let's dive in.
So right off the bat, what jumps out from these questions is experience. You absolutely need it.
Yeah, this isn't an entry-level thing. They're assuming you've been in a clinical setting for a while.
Definitely. We're talking typically maybe 5 years of direct patient care,
Yeah,
and then crucially,
that supervisory part.
exactly. Maybe around 2 years where you've actually managed people, even in a small team lead capacity.
So seasoned folks.
Absolutely. And those sample answers, they consistently bring up things like coordinating staff schedules, supporting patient care standards, making sure everyone's following clinical protocols. That's the foundation.
Okay, so you've got the experience, you've maybe led a bit. But healthcare settings, they get busy, things can get tense. What about conflict between staff?
Ah, yeah, that's a big one. Conflict resolution skills are, well, indispensable. The questions hit this directly.
How do they expect it to be handled?
The consistent theme is acting promptly, don't let it fester, but also stay calm, stay professional.
Right, you don't want to add fuel to the fire.
Precisely. And the strategies mentioned focus on, active listening, really hearing both sides.
And then trying to get them to work it out together.
Yeah, facilitating collaboration. The goal isn't just stopping the fight, it is preserving that team cohesion,
Yeah,
professionalism.
that makes total sense. Teamwork is critical for patient care.
Couldn't agree more.
Okay, let's pivot a bit. These environments are incredibly busy. How does an assistant clinical manager juggle everything? Prioritize.
Yeah, prioritization and just efficiency are huge. Interviewers really probe on this. How do you manage that constant flow?
So what's the approach?
It seems to be about assessing urgency first, always.
Yeah.
What needs doing right now. Patient safety is like the #1 filter.
And then considering the impact of the task.
Right. How important is it? What happens if it doesn't get done? And delegation comes up a lot too.
Ah, knowing what you can hand off.
Exactly. You can't do it all. Effective delegation is key. And interestingly, some answers mention digital scheduling tools specifically.
Shows how tech is embedded now.
Definitely. It's part of managing efficiently.
Now, there was a concrete example in there about process improvement, wasn't there? That seemed really insightful.
Oh yeah, that was a great one. It really shows the proactive side of the role.
Tell us about it.
So this person noticed a bottleneck with patient discharge summaries.
Hmm.
Things were getting held up.
Oh,
Their fix was pretty smart, but simple. They brought in a checklist and improved how nurses and doctors communicated about it.
again, the result.
Like 30% reduction in turnaround time. I mean, that's a tangible improvement. It shows real impact.
That kind of specific achievement, yeah, that speaks volumes in an interview, I bet.
Absolutely.
Okay, switching gears again. Healthcare means regulations, lots of them. How does the ACM keep the team compliant?
This requires ongoing effort. You can't just learn the rules once.
Right, things change.
Exactly. So staying updated through workshops, reading journals, that's essential. But knowing isn't enough.
You have to ensure the team follows through.
Precisely. And the how involves things like regular audits, checking if practice matches policy,
Okay.
plus good staff training, obviously, and just constantly reinforcing those protocols, making it routine.
Makes sense. Let's talk about the staff themselves. Managing performance, supporting the team, how does that work?
Yeah, staff performance is a core responsibility. It really starts with setting clear expectations. Everyone needs to know what good looks like.
Okay, clarity first.
Then it's about continuous feedback, not just waiting for the annual review.
More like ongoing coaching.
Sort of, yeah. Regular check-ins.
Yeah.
But those former reviews are still important too.
For goal setting and bigger picture stuff.
Exactly. And a key part is offering support, helping staff develop, improve their skills. It's about fostering growth.
Yeah, a tough reality. Staffing shortages. It happens all the time in healthcare. How do they navigate that?
Patient safety has to be the absolute top priority, no question.
So what are the tactics?
Well, redistributing the workload as fairly as possible is one thing. Trying to avoid burning people out.
Right.
And then actively looking for backup, calling in extra staff if you can, agency, per diem, whatever options exist.
And morale must take a hit during those times.
Oh, absolutely. So acknowledging the extra effort, showing appreciation, that's incredibly important for keeping spirits up, recognizing the team's hard work.
What about bringing new people onto the team? Training.
Good onboarding is really critical. You want to set them up for success.
So what does that look like?
Pairing them with an experienced mentor is a common strategy, someone they can go to with questions.
Peer support.
Exactly. And hands-on training, obviously. Plus, scheduling follow-ups to check in, see how they're settling in, address any early hurdles, make them feel supported.
Okay. And patient confidentiality, that's huge. How is that managed?
It has to be ingrained in the culture. Strict adherence to HIPAA guidelines. Always.
How do you ensure that?
Using secure communication channels is vital. No texting patient info on personal phones, things like that, and ongoing education. Constantly reminding staff about privacy rules. For anyone listening, IPI is basically the U.S. law protecting patient health information privacy.
Got it. Now, the flip side of performance management, what happens if someone isn't meeting standards? Underperforming staff.
Yeah, that's never easy. The suggested approach is usually quite structured.
How so?
First, try to understand why. Is something going on? Is it a skill gap? A personal issue?
So investigate before jumping to conclusions.
Right. Then it's about providing really clear, constructive feedback, specific examples, actionable steps.
And it doesn't stop there, right? There's usually a plan.
Correct. Often a formal performance improvement plan, or a PIP. This outlines specific goals, timelines, and includes regular check-ins to monitor progress and offer support. The aim is improvement, if possible.
Okay. Moving from individual staff to the whole team's effectiveness, how does an ACM measure that?
This is where data comes in. It's a data-driven role in many ways.
What kind of metrics?
Key things like patient outcomes are patients getting better. Staff-to-patient ratios are important for workload. Readmission rates are patients coming back unexpectedly. And patient satisfaction scores, how is their experience?
So a mix of clinical and experiential data.
Exactly. It gives a broader picture of how well the unit is functioning.
And managing all this data often involves technology, like electronic health records, EHRs. What's expected there?
Oh, proficiency with EHRs is pretty much a given now.
Yeah.
Systems like Epic or Cerner are mentioned often.
And how are they used by the ACM?
For all sorts of things. Checking charting accuracy, pulling reports on those metrics we just discussed, tracking performance indicators. They're central to workflow.
Communication seems like it would be absolutely vital in this role, too, keeping everyone connected.
Hugely important. You need multiple channels.
Like what?
Regular team meetings are standard, using shared digital platforms, secure messaging, dashboards, and having an open-door policy, making sure staff feel they can actually come and talk to you.
Creating that accessible environment.
Yes, exactly. It's about smooth information flow.
Healthcare changes so fast. New treatments, best practices. How does an ACM keep up?
Lifelong learning, it's non-negotiable, really.
So conferences, journals.
Yep. Attending seminars, reading the key journals, doing continuing education. You have to be proactive about staying current and then bringing that knowledge back to the team.
What about leadership style? What tends to work best?
The answers generally point towards a collaborative, supportive style.
Not top-down, authoritarian.
Generally not. More about empowering the team, encouraging autonomy, but still providing that guidance and support when it's needed. It's a balance.
Can you give an example of a tough decision they might have to make?
Well, one example they came up was having to reassign a nurse because of repeated complaints.
Oh, yeah. That's difficult.
Very. You're balancing the individual situation against team harmony and ultimately patient care quality. Never easy calls.
The title is Assistant Clinical Manager. How do they support the main clinical manager or director?
They're really crucial support. They handle a lot of the day-to-day operational stuff.
Taking things off the manager's plate.
Exactly. Managing staff concerns, compiling reports, ensuring departments are communicating well. It lets the manager focus on more strategic, bigger picture items.
Okay, what about something seemingly smaller, like staff tardiness? How's that handled?
Even small things can impact the team. The approach suggested is progressive. Start with a private chat. Understand the reason, if there is one. Then clearly set expectations about punctuality.
And if it continues?
Then you follow HR procedures. It ensures fairness and consistency. You have to address it, but professionally.
And promoting a culture of safety, that sounds critical.
Absolute paramount. It has to be proactive.
Oh, what does that look like?
Things like running safety drills,
Hmm.
really encouraging and normalizing the reporting of near misses so everyone learns from them,
Uh-huh.
and just making safety part of the daily conversation, huddles, meetings, constantly reinforcing its importance.
Okay, last big area from the interview perspective. Why this role? What motivates someone to want to be an assistant clinical manager?
The strong answers usually talk about a real passion for both clinical quality and leading teams.
So combining those two interests.
Yes. Wanting to use their clinical background to have a broader impact,
Yeah.
contributing to how well the unit runs and ensuring great patient care. It's about operational success, too.
So wrapping this up, it's clear the assistant clinical manager role is, well, it's a lot. Very multifaceted.
Definitely. You need that solid clinical base, strong leadership skills, and this deep commitment to patients, staff, and all the rules and regs.
And a focus on problem solving and making things better seems key too.
Absolutely. Proactive improvement. Being able to balance the daily chaos with the needs of your patients and your team. These interview questions really do frame the core challenges and expectations quite well.
It really does feel like a constant balancing act, doesn't it? That tightrope walk between upholding high standards for care
Hmm.
and also genuinely supporting your staff who are working in such a demanding field.
Yeah,
It makes you wonder what specific leadership qualities are truly the most critical to navigate that effectively. Something to think about.
definitely food for thought.
Thanks for exploring this deep dive with us today.